All right, friends, we're back, and this time we're going to talk about the digestive system. This PowerPoint's pretty long, so we'll do it in a couple takes. First off, with the digestive system, it's basically this tube that runs from your mouth all the way to your anus. And maybe while we're talking about this system, we can figure out why salad is so funny. But apparently it's hilarious. I don't know why. So what the digestive system does is it processes the food, it extracts the nutrients, and then you get rid of the waste. And we can do that in 5 steps. The first step is selective food intake, or ingestion. We start selecting which foods we are going to eat when we are very young. And that spaghetti looks fantastic. I love pasta. And that's basically what I look like when I eat spaghetti. And so with your ingestion, with this selective food intake, you're choosing what you want to put in your body. I remember my nephew went through a beige phase where he would only eat food that was beige. Some people grow out of that, some don't. So the first part is ingestion, and then you have digestion. So we have to break down that food that you ingest. And it can be done 2 ways. You have mechanical and chemical, and we do it both ways. And then you get to the absorption phase. So this is when the food really gets in your body. Because this tube, it's a hollow tube that goes from your mouth to your anus. Like, when you eat food, technically it's not in your body. It's in a hollow tube that is outside of your body, right? So that tube is just from one end to the other. You could swallow a string, and if it was long enough, you could pull it out the other end, right? So it's this absorption phase that really takes that food and brings it into your body. Because before that, it's just in this hollow tube that is out in the environment. And then you have compaction. So we're going to pull all the water out of that food, and then we're going to consolidate the residue or the waste. And you're going to compact that waste to get ready to ship out. And that's the last one. So defecation, it is the last step in digestion. So we are getting rid, we are eliminating that waste from your body. So ingestion, I think most of us know how to put food in your mouth, but you might not know so much about the digestion part. So when we're talking about mechanical digestion, there are 2 areas that this happens. One is in the mouth, with chewing and cutting with your teeth, breaking it into those smaller bits and pieces. And the second one actually happens in the stomach. So your stomach has 3 layers of muscle. And so that muscle crushes and churns and moves the food around to digest it mechanically. And then we have our digestion that is chemical. This is probably what you think of when you think of digestion, is chemical digestion. You have your digestive enzymes from your salivary glands. So those glands in your mouth and the surrounding area. Your stomach has some digestion. Your pancreas does a ton of digestion. And then we have some more digestion in the intestines along the microvilli. So you can see here, the mouth has salivary amylase, stomach has hydrochloric acid and pepsin, the duodenum has your pancreatic amylase and lipase and trypsin, and then the small intestine has lactase, maltase, sucrase, and peptidase. So breaking down a lot of the sugars down here in your small intestine. So of your digestive system, you basically have two parts. You're going to have the alimentary canal, so that tube that goes from mouth to anus, and you're going to have accessory organs like your teeth and other glands that support digestion, like liver and the pancreas. So we're going to talk about the alimentary canal first. It's just this big muscular tube going from the mouth to the anus. When you're alive, it's about 5 meters long. So that's roughly 15 foot, give or take. When you're dead, it goes out to 9 meters long. The reason you see that change is because when you die, you lose the muscle tone that was holding it shorter, and so it relaxes and ends up being about 9 meters long total. As we look at it, sometimes you'll hear me refer to the GI tract or the gastrointestinal tract. And gastro refers to the stomach, intestinal refers to the intestines, and so the GI tract starts at the stomach all the way to the rectum, where your alimentary canal starts at the mouth and goes all the way to the rectum. Our accessory organs, so we're going to have our teeth, your tongue, salivary glands, liver, gallbladder, and pancreas, and we're going to talk about most of these. Alright. So again, that alimentary canal, your digestive tract, tube from one end all the way to the other. You have 4 layers that make up your alimentary canal. The deepest layer, which we see right here at the top, is going to be the mucosal layer. And so it secretes stuff like mucus, and you also have some digestive enzymes in that layer. It's made up of epithelium. What type of epithelium do you find in your intestines? You're going to be finding simple columnar epithelium. It has a lamina propria, which helps to support that epithelium, so it has connective tissue. And then you have a muscularis mucosae, which it's some smooth muscles associated with this mucosal layer. And then going out from there, or going more superficial, you're going to have your submucosa. It's just going to be a layer of connective tissue. You're going to have your blood and your lymphatic vessels there, and your nerves. And so you can see here in that submucosal plexus right here, blood vessels and nerves. And then you go out to your muscularis externa. For most of the alimentary canal, you're going to have 2 layers of muscle. When we get to the stomach, we'll talk about that. You actually have 3 layers of muscle in the stomach. With this muscularis externa, you're going to have an inner circular layer, so a layer that runs around it. And when that contracts, it's going to squeeze like this. And then you're going to have a layer of longitudinal that when it squeezes, it's going to push forward. And we'll talk about how that works when we talk about peristaltic contractions. And then the outermost layer, or the most superficial layer, is going to be the serosa. Sometimes this is called the adventitia, but it's just some of that areolar tissue topped with simple squamous. So here, looking again, all this is mucosa. You're going to have your simple columnar right here. And then you come out, you can see that muscularis mucosa right there, and then we come out to the submucosa. Some glands are situated in the submucosa, but lots of nerves and vessels, arteries and veins associated with this submucosa. And then as you move out, you have the muscularis. Here you can see that circular muscle cut this way, that longitudinal muscle cut this way, and then just some areolar tissue and simple squamous to make up the serosa. So which physiological process of digestion truly moves nutrients from outside to inside the body. That is going to be absorption. And then what two organs that are used to mechanically break down food? You're going to have your teeth, and you're going to have your stomach. Speaking of teeth, why do we chew our food? Well, you want to break it down into small pieces, right? Have you ever tried to swallow something really big? It kind of hurts. So you want to make it small, not just because it's easier to swallow, but also you're increasing the surface area for enzymes. So if you have something big like this, and the enzymes can only work on this outside layer. If you have a bunch of little small things, then the enzymes can work all around those. And so it increases that surface area for enzyme. It makes digestion much more efficient. Anytime you have anything in your mouth, so it doesn't even have to be food. You could have a toothpick or something, and we naturally have a chewing reflex. So anytime something's in your mouth, you're going to want to chew that. It's just a neat little thing that we have. All right, so what helps with mastication? What helps with chewing? Well, you have the muscles of your tongue, the buccinators, orbicularis oris, and all three of these muscles just try to put that food in between the parts of your teeth. So just think of the parts that you have ever bitten when you're chewing on something. Probably bit your lip, that orbicularis oris. Probably bit your tongue before, and maybe your cheeks with those buccinators. So these are all places that as you're chewing, they are moving in and out. So whenever you open your mouth, it's trying to put food in the right spot. And if you're too eager, you might bite down on it and not the food. And then that causes it to swell, and then you're probably going to bite it again, and no fun. Other muscles that are important are going to be your masseters and your temporalis. We've talked about these before on previous tests when we were talking about muscles. So the masseters, these muscles right here, when you bite down, you can feel them. And then your temporalis up here, same thing. When you bite down, you can feel those. So that those allow you to do that, biting down. Then you have your pterygoids. A lot of y'all mentioned those when I ask about muscles used for chewing. The pterygoids are going to be inside, and they allow you to go side to side with your jaw. Masseters also help with that. All right. So staying still in the mouth, what does your spit do? Why do we have spit? Have you ever had dry mouth? Have you ever seen people try to do that saltine challenge where you try to eat a whole bunch of saltines? Spit's really important. It helps to moisten and clean the mouth. In your spit, you have a bunch of lysozymes, things that kill bacteria. And so people who have dry mouth disorders have to use special mouthwashes often because they end up getting a lot of plaque buildup and bacterial buildup on their teeth. Your spit is also really important in chemoreception. So all your chemoreceptors, those chemicals, first have to be dissolved in a liquid. And in our mouth, that liquid that dissolves those chemicals is going to be our spit, which is really cool. And we have enzymes that start breaking down fats and starch. So you have a lingual lipase and a salivary amylase that breaks down fats and starches. And it also turns the food into a bolus. So as we get that food nice and wet, you can kind of mush it into a ball that's ready to be swallowed. So you don't just swallow like a big long string of stuff. You form it into this nice little compact ball to swallow. So what's in your spit? Most of it's water, like 99% of it's water. There's a lot of water in your spit, depending on which autonomic nervous system's working. So you have a sympathetic and parasympathetic. and your sympathetic can decrease this amount of water and increase the mucus in there, because you do have mucus in your spit. That mucus is important in binding that food and lubricating that food bolus so it slides down easily when you swallow it. And then you also have electrolytes. So salts like sodium, potassium, chloride, phosphate, and bicarbonate. You have lysozymes. These things kill bacteria. Very important. Here you can see a couple of them. You have immunoglobulin A, or IgA. IgA has antibacterial properties, so it binds bacteria and breaks them down. And then, of course, our salivary amylase. This one is important in breaking down starches coming from our major glands. Lingual lipase also breaks down fats, and you'll find that associated with your tongue. Speaking of these salivary glands, we have two major types. You have major and minor, or intrinsic and extrinsic salivary glands. The intrinsic ones are going to be ones that are found in the mouth. So you have lots of little glands all over the mouth, on your tongue, on your lips, on your palate, on your cheeks. And these contain both the lipases and the lysozymes. And so these are the ones that are fighting the bacteria and breaking down the fats that are in your food. And you can stimulate these intrinsic ones if you just take your tongue and rub it on your lip or on your cheek. You can make more saliva that way. And so they react to like having food in the mouth too. Then your major ones, that's going to be these three right here. So you have your parotoid or parotid salivary gland up here by the ear, your submandibular down here on the lower, on the mandible, and then sublingual underneath the tongue. Your extrinsic salivary glands make over 1 liter a day of saliva. So this is not including these intrinsics. This is just extrinsic only, and they are the major ones. They make a lot of saliva, right? You just think of like a liter bottle of spit that you make every day. That's a lot. Parasympathetic nerves at the salivatory nuclei in the brainstem. So if you look at the brain, this is my brain right here. You have the frontal part. This is going to be the occipital area with your cerebellum back here. Down here, you're going to have the pons and the medulla oblongata. And basically, right between the two of them is where you're going to have this salivatory nuclei. And this causes these salivary glands to start secreting saliva. So, what makes you salivate? Well, probably the first thing you're thinking of is food, right? Food makes you salivate. Is it food in your mouth? Is it seeing food? Is it smelling food? Is it thinking about food? Yes. Yes, it is. Any thoughts, smells, sight, food in your mouth makes you salivate. So it activates that nuclei, which activate those salivary glands. It's getting you ready. Also, spicy food and sour food can make you salivate more. I don't know if y'all ever had those little warhead candies before. They're super sour. Or even lemon drops. Like, you put them in, causes that bite in your cheeks, and it also increases the amount of saliva you secrete, which is pretty cool. But how about when you're about to throw up? That also causes you to salivate, right? And so stomach acid can cause you to salivate, and so can other toxins that you ingest. So, your pharynx, here's our mouth right here, nasal cavity. So we bring in the food, there's the tongue. You swallow it, this is called the oral cavity. You swallow it, and it comes back here to the oropharynx. Above it is the nasopharynx. And then below that is the laryngo. So here's your larynx, or your voice box, right? And so you have your laryngopharynx right behind the larynx. In this pharynx, you're going to have a superior esophageal sphincter right here before the esophagus. And then as you move down the esophagus, you have a lower esophageal sphincter. So the esophagus has two sphincters, an upper and a lower, or superior and inferior. And it's this lower esophageal sphincter that can cause GERD, or gastroesophageal reflux disorder. If you get a bunch of heartburn, it could be because of GERD. As your stomach acid pushes up into the esophagus, it can actually eat away the esophagus and damage it over time. Alright, so how do we get food from the mouth down the esophagus and into the stomach? Well, you swallow it, right? Swallowing has a couple different phases. The first phase is going to be the oral phase. So you have the food in the mouth, you formed it into a nice little bolus. Is swallowing voluntary or involuntary? It's going to be voluntary, and so you contract these skeletal muscles that pushes the food back into the soft palate. The soft palate lifts up and blocks off the nasopharynx so food doesn't go out your nose when you swallow it. That would be bad. The tongue pushes down on the epiglottis, and the larynx pushes up, and you close off the trachea when you swallow so stuff doesn't go down into the trachea, because that would also be bad. And so this is that pharyngeal phase. And after it gets to this phase, now you're in the esophageal phase, and you have smooth muscle that pushes that food bolus down through the sphincters and into the stomach. Peristaltic contractions are wave-like contractions. So here you can see that circular muscle closes off, and then the longitudinal kind of just squeezes it forward. And then the circular will close off, and the longitudinal will squeeze it forward. It's kind of like when you're squeezing a tube of toothpaste. You don't just grab it in the middle and pinch, because then the toothpaste goes two different directions. You grab it, and then you work it down, right? And that is how peristaltic contractions move food and waste throughout your body. So once we get stuff in the stomach is where we're going to pick up on the next one.